if the man comes in, when the man comes in, there are some guidelines, like you have to get an 8 a.m. testosterone level with other labs. If that's low, you repeat it to confirm, and then you take it from there, right? We, in our program, are always trying to get the person to be able to do their job on their own. So we look at a lot of variables, from their diet, which is very important, because inflammatory diets that contain the sugar, the processed foods, too much animal protein, too little plant food. We have seen that over and over and over play a big part into what could be construed as hypogonadism. And then you sit down with the person and you modify. You know, a lot of these people that we see are motivated, and then you modify some of these factors, and this apparent hypogonadism is actually resolved. But there are those that, no matter what you do, they have a level of testosterone that is interfering with the quality of life. There are instruments like the ADAM questionnaire, which is the androgen deprivation in the aging male questionnaire, and it's a good tool for men. You know, now men come in for themselves, they come in with their partners, because it's, you know, this testosterone thing has become popular, right? They come in, and when we ascertain that the person is a candidate for that, there are different ways of doing it. There are gels, there are patches, there are injections, and there are pellets. And what we do, subcutaneous pellets, and then what we do, we match the best therapy to the particular patient's needs. Sitting on my side, the phone rings, so a lot of them find us. I think that there's a lot more awareness. Instruments like the ADAM questionnaire are readily available on the internet, and people can find them. Interesting, testosterone for men has many dimensions, and possibly the sexual dimension might be one of the last. Although, ostensibly, when you say testosterone, everybody thinks about sex. Many times we've had men that had been unmotivated, tired, overweight, downright depressed, not taking a new job for years. And then finally, when the sexual component becomes an issue, either for themselves or for the life of the couple, then finally something happens and causes that. But I think I'm seeing more openness, even in family practitioner doctors, to at least check it, and certainly patients check. Then from there to have the person actually get involved with it is a different story. Urologists, of course, they do it all the time. So I think actually it's probably not that hard for a person who's thinking that the testosterone should be checked to have that done. There are some forms of testosterone in Europe that might be a little easier to use if they ever make it through, the FDA, and we'll have to see what comes out of the studies that they're doing over there now. About the same. In other words, there's never going to come a time in which testosterone is going to be a magic wand. We will have, hopefully, we will have more answers. We'll have more studies. I think there are more studies being in the works. But the rule remains. It's not a scourge, nor is it, the panacea, the magic wand. It's good medicine. In other words, we now know that testosterone and prostate cancer don't have the relationship that people think they did. We know that testosterone probably does not cause it. We see how many times people with lower urinary tract symptoms, including prostatic hypertrophy, the enlargement of the prostate, actually benefiting from testosterone. So it's interesting how, as we collect the data, we get the message again over and over is you need to do a careful history, a physical exam. You need to get your biochemical data, and then you see if a person is a candidate for this therapy. And that's good medicine.